Well, this story is unbelievable. So over 200 women are joining together in a lawsuit against an OBGYN who is accused of sexual assault on them. You won't believe some of the things he allegedly did and said. The number of allegations against this Utah doctor, which was, like I said, an OBGYN named Dr. David Broadbent, is literally doubling. What originally began with just 4 women accusing him has now escalated to over 200. Initially, only 94 women filed a lawsuit against David, but last month, the Utah Supreme Court overturned the lower court's dismissal of the case. So now more women have come forward. So in 2022, the lawsuit that was filed by 94 women was dismissed to begin with because the judge said that it should instead be a medical malpractice case. However, the recent Supreme Court ruling has allowed the case to proceed. And again, that's led to the increase in victims coming forward. David was luckily charged in June of this year, so a few months ago, with forcible sexual abuse. These women who are from different towns and have different backgrounds all had similar stories. They had very similar experiences and allegations against this so-called doctor. He allegedly had horrible behavior during medical exams, and I'll tell you some of the things he did and said in just a sec. Reportedly, he was a gynecologist whose office was in Provo, Utah, and it was near Brigham Young University. I'm going to refrain from telling the victims' names, even though they have come forward and been named in lawsuits. I'm just going to tell you their stories and allegations against him. One victim said she was a student at BYU when she first went to him. She said the vaginal exam, I don't know what words I can or can't say. I hope I can say that word. She said it was very painful and that he then performed a rectal exam on her. I don't know of OBGYNs that do that. Furthermore, and this is terrible, listen to this. After she went to him, another doctor found signs of an STD. She had an STD, but guess what? She was a virgin. You know why she said she got the STD? Because he did not use gloves on her when he performed the exam. No joke. Allegedly, this was quite a bit normal for him, I guess. I don't know if he would just go from patient to patient doing that or not. I don't know. But this lawsuit literally says the girl was a virgin, and then after him doing this, she had an STD. She said it was painful and she felt violated the whole time, and it just felt off and wrong to her. Another victim went to him in 2020 regarding a bump in her vaginal area. David instructed her to undress from the waist down, but when he got back into the room after she changed, prosecutors say he touched her breast, then he grabbed her leg in a sexual manner. That was before he began the vaginal exam. Other patients insist that he would say things to them like, "This is every girl's favorite part," or "You like that, don't you?" Unbelievable. Another victim said he would not tell her what he was about to do to her or anything. He just did it. And as he was finishing, he said, "Well, your husband's a lucky man. You gotta be kidding me. This is totally inappropriate." He also allegedly told a woman who was pregnant out of wedlock that she was going to hell, but he said not to worry, that he would help. She said that exam was so painful that she ended up miscarrying 2 days after it. Many of the women who made reports to police say that David inappropriately touched their breasts, V-words, and rectums. This was during exams, and most of the time it was without a warning or an explanation of any type. It was said it was done in ways that would hurt them and make them feel violated. And here's what's really messed up about all this. Former patients allegedly told staff what was going on with this doctor. You know what they were told back? This isn't the first time this type of behavior has been reported. But guess what? Nothing was ever done. So now they may be facing a lawsuit too for not handling it. Police were also allegedly told about all of this, but they dismissed it, saying, "Oh, that's medical, we don't do that." He has luckily agreed to stop practicing medicine while the criminal investigation is taking place. This is all outrageous, alleged behavior, and these victims deserve justice. I hope all this disgusting man has done over the years comes to light and that he gets punished properly. For more true crime, please remember to give me a follow and to visit my website at www.truecrimewithmegan.com. I will provide an update in this case.